The next specimen is the kidney. And we've got pretty extensive annotations in the kidney that should help you study the kidney. The first one shows the fact that over here is a cross section of the kidney, and then there's a longitudinal. And actually, this is an animal kidney because it demonstrates things very well, and it only has one lobe actually, with a cortex here, medulla here, and then you can see the long part of the medulla extending down into the calyx here. So the cortex uniquely has glomeruli. That's how you know you're in the cortex. And if you zoom in on the specimen, we ask you to identify it. And the minute you see glomeruli, then you have to be able to recognize them, because there's a glomerulus right there, and there's a glomerulus, and all of the other cells in here are lining the proximal and distal tubules, and in some cases the medullary rays, which would be rather straight tubules, for example in this region right here. But where you see the glomeruli, that's in the cortical labyrinth, and I'm going to go on to this annotation, which will show you a macula densa, which is the place where the distal tubule touches the vascular pole of a glomerulus. And this particular glomerulus shows the junction between the proximal convoluted tubule and the urinary space in the Bowman's capsule. And the Bowman's capsule, of course, is a capsule with podocytes, the visceral epithelium of the glomerulus or Bowman's capsule, and then the parietal epithelium, the flat cells here on the edge. And now you can see here, this is a very, very fortunate slice through the urinary pole, UP, and the vascular pole, showing the macula densa. That just shows the whole relationship. And of course, the other challenge is to be able to know when you're looking at a distal tubule or a proximal tubule. All the proximal tubules, the lumen looks pretty muddy because it's composed of a lot of long microvilli, whereas the distal tubule, they are very clean. This is a distal tubule here, and here the nuclei are usually a little closer together. So you'll need to look around. I'll try a couple more annotations. This is showing the urinary space of Bowman's capsule. The green area is pointing to the nucleus of a podocyte, which forms the visceral layer of Bowman's capsule, and then the yellow arrows are pointing here, this one, to the nucleus of one of the simple squamous epithelial cells forming the parietal layer. And let's see what we have here. And here we're showing a collecting duct cells that have definitive cell borders. So the big take-home thing about the kidney is to recognize the difference between proximal tubules and distal tubules. Know the difference between the cortex and the medulla, where you have in the medulla are all tubules and vessels. So correlate your correlate your lecture information with the lab as you study these two profiles of the kidney. Now, I guess before I leave, one other thing. What is this tissue here? So this tissue that we're looking at is multilocular or brown adipose tissue. You see the multiple lipid vacuoles in each cell rather than one big single vacuole in each cell. And amongst the brown fat, you have occasional white adipocytes, white adipose tissue cells. Okay, so I'm going to leave this specimen, and we have one more specimen, that's the pancreas.